COVID-19 severity and body composition. In a recent study posted to the Medrix of preprint server, researchers assessed the effect of changes in the abdominal well-being and physique on coronavirus disease 2019, COVID-19, severity using magnetic resonance imaging, MRI. Previous studies have reported debilitating effects of COVID-19 on cardiac, respiratory, renal, liver, and pancreatic health. However, organ-wise delineation of fat content and its effect on COVID-19 severity using MRI has been limited. Study: Abdominal imaging associates body composition with COVID-19 severity. The researchers conducted a prospective study to compare MRI images of COVID-19 patients to pre-pandemic MRI images of the United Kingdom Blood Bank, UKBB, longitudinal study performed after February 2021. MRI scans of 1,800 individuals were obtained from UKBB and compared to post-COVID-19 MRI scans of 967 cases and 913 controls. Along with the MRI images, demographic data including the sex, height, age, blood pressure, ethnicity, smoking status, body mass index, BMI, waist/hip ratio, Townsend deprivation index, and diagnosis rate of common diseases were obtained. In addition to the matched cases and controls, 140 individuals were included in the study based on the severity analysis of the UKBB data. Single-slice MRI images, D1 weighted, T1W, pancreatic volume, and 3D segmentation data were obtained. The images were processed with convolutional neural networks, CNN, to image-derived phenotypes include visceral adipose tissue, VAT, abdominal subcutaneous adipose tissue, ASAT, iliopsoas muscles, lungs, kidneys, liver, spleen, and pancreas, IDPs. Researchers constructed a random forest classifier model based on demographic data, age, height, sex, BMI, and IDPs of visceral fat, liver fat, and iliopsoas muscle volume to determine if machine learning could be used to categorize and forecast COVID-19 severity. Knee to Knee in the UK, a COVID-19 study participants' biobank MRI and 3D renderings of image-derived phenotypes developed for the same individual after image pretreatment and segmentation methods. Liver, yellow; lungs, blue; spleen, purple; kidneys, green; abdominal subcutaneous adipose tissue, white; visceral adipose tissue, orange transparent; iliopsoas muscles, pink; pancreas, orange transparent, red. Age, BMI, waist/hip ratio, blood pressure, smoking, and male gender were all connected to COVID-19 severity. COVID-19 severity was connected to lower lung and iliopsoas muscle volume, as well as higher liver and fat volume. The severity of COVID-19 disease was affected by increased hepatic PDFF. Males may be more susceptible to severe COVID-19 than females due to higher visceral fat buildup. VAT may be connected to COVID-19 severity because of increased levels of angiotensin-converting enzyme 2, ACE2, in visceral fat. Higher ACE2 levels encourage the production of pro-inflammatory cytokines, contributing to the cytokine storm seen in COVID-19. LOT levels may contribute to COVID-19 severity by increasing cytokine production and decreasing vitamin D levels. Although liver fat IDPs, visceral fat IDPs, and muscle volume IDPs were all predictive markers of COVID-19 severity, the study indicated that visceral fat was the most useful biomarker.
Thank you for watching. Hope you will like the video I created for you. Please support me, click on subscribe. Then click on the bell. Please tap the below to view videos of the same series.